COVID-19 pandemic affected response and access to health services for HIV, tuberculosis and malaria patients. 3 reports launched by the Ministry of Health, Amref, and the Coalition for Health Research and Development showed that redeployment of healthcare workers to manage the pandemic strained an already overburdened health workforce, resulting in limited access to health services. Stakeholders in the health sector have recommended concerted efforts to safeguard the country's gains in access to health services that was greatly affected by the pandemic.
So, welcome.
You're going to have accounts.
There are 3 fears expressed during the pandemic. One is the fear of discrimination, especially among TB patients who are often mistaken for COVID-19. There was a second fear of being infected for those who already had immunocompromised conditions like HIV and TB, and fear of being tested because of the related consequences of being put in isolation and quarantine. Of course, there are challenges of financial and social constraints as a result of supply chain challenges, leading to unavailability of drugs and testing services. Therefore, in the context of a very low economic activities, patients reported the challenges of being able to incur extra costs. And
gender played a key role in the uptake of COVID-19 vaccination and other tools, including diagnostics of the same among the women. And the key cited factors, one is limited decision-making power, that you need clearance for you to go and get a vaccine, and of course dependence on men who control resources.
The analysis of systematic equity and gender issues affecting products introduction and access to COVID-19 tools in East African countries is an evidence base that can help to address gender-related barriers and inequities in communities and health systems.